Hi guys, we are presenting on postpartum depression. We are group 3, subgroup 2. Our team members are Baron, Zuhe, Jason, myself, Henry, and Elinda. I'll be talking about what major depression disorder is. Short form is MDD. So major depression disorder is one of many health conditions usually characterized due to the person's feeling of sadness, mood, or loss of interest in activities or people. So it is a persistent condition that continues to affect the person's daily life for a longer period of time. Sadness or emptiness or physical changes can happen on the person itself, such as weight loss. So it's usually diagnosed by the clinical history of the patient, examination of their mental status by either the doctor or the psychiatrist, depending. Then under MDD, there are a few different types of it. So there's the persistent depressive disorder, seasonal affective disorder, psychotic depression, atypical depression, and postpartum depression, which we will be focusing on it. So why postpartum disorder? Based on the news recently done by CNA, it showed that in Singapore, Women's Hospital here reported a 47% increase in patients who screened positive for postnatal depression between 2021 and 2022 March. So it is a concern itself when news of it are going on, being faced by the woman, showing the increase in challenges. Then it may be often overlooked. So based on the National Institute of Health as well, around 1 in 7 women can develop postpartum disorder. So in our line of work, it's also good to understand more about it as there's a possibility of it occurring itself. Then postpartum and postnatal disorder are terms usually used interchangeably but usually typically means a minor or major depression during pregnancy or after pregnancy itself. So an introduction to postpartum depression is that it's a complex mix of physical, emotional, and behavioral changes that happen in some women after giving birth that begins within 4 weeks after delivery. It can happen immediately after delivery, or it may take some weeks for it to slowly develop. The diagnosis of postpartum depression is not only based on the length of time between the delivery and onset, but also on the severity of the depression. So sometimes it's linked to the chemical, social, and psychological changes that happens when having a baby. A range of physical and emotional change may happen that many new mothers experience. So PPD can be treated with medication and counseling. So the chemical changes involves in a rapid drop in hormones after delivery. So this drop in depression is still not clear. But what is known is that the estrogen and progesterone, the female reproductive hormones, increase tenfold during pregnancy. So after delivery, it drops sharply. By the 3rd day after a woman gives birth, the level of these hormones drop back to what they were before pregnancy. Some social and psychological changes happen of having a baby can also create an increased risk of depression. Fathers are not immune as well. Research shows that 1 in 10 new fathers get depression during the year their child is born. Next, I'll be handing over to Jason.
Okay, so I'll be presenting on the types of postpartum depression. So each type has its own risk factors, signs and symptoms, types of treatment, and progressions. And the types of postpartum depressions are divided by severity. Symptoms can range from short-term and mild to acute and intense, or even to chronic and severe. So the different types of postpartum depression we can see are postpartum blues, or referred as baby blues, postpartum anxiety, postpartum obsessive compulsive disorder, postpartum panic disorder, postpartum post-traumatic stress disorder. The most severe one would be the postpartum psychosis. So regarding the signs and symptoms of postpartum depression, the cognitive signs we can generally see are recurring thoughts of death, suicide, feeling worthless, even wanting to kill or harm their own baby, and feeling anxious or a lack of interest in their baby. And they may feel shame, guilty, or inadequate to be able to take care of the child. Hypervigilance or paranoia may be seen, and there may be the mother may display too much energy and also feeling upset at the same time. For behavioral signs and symptoms, we may see severe mood swings, showing irritability, withdrawal, and increased sensitivity. And there may be a loss of appetite or energy, inability to sleep, or on the other hand, sleeping too much, and unable to focus and complete day-to-day tasks. It may show aggressive behavior where the mother may be easily provoked, or even trying to harm themselves or the baby. There may be a lack of interest in activities that she used to enjoy, and also lower libido. Social signs and symptoms of this disorder may be seen with strained relationship with husband, and having difficulty bonding with the baby, and withdrawing from their family and friends, and also lack of communication. So now I hand over to Elena to share on the persona for case study.
Okay, so I will be presenting on the persona of the case. Our main character is actually a female 25-year-old. Marital status is married with one newborn. A background on on her, she's actually staying with her husband and her mother-in-law during confinement period. Husband is working shift 3 days, 1 off, 2 nights, 2 off on repeat, similar to what we are doing. Okay, so turn out, cortex is actually a medical cardiac arrest P1 plus. On the cortex itself, it's written daughter-in-law is actually strangling the baby. The grandchild is actually purplish. It's actually caught by the grandmother of the baby. On arrival, the baby is cyanotic, no pulse, no breathing. Resuscitation is performed, and they actually successfully resuscitated the baby. So history taken from mother-in-law. According to the mother-in-law, she heard the daughter-in-law screaming, stopped crying, and went to check on them, only to realize that the daughter-in-law is actually suffocating the baby. She quickly stopped her daughter-in-law's action and called for help. Upon further questioning, we understood from her that her daughter-in-law has been suffering from severe mood swings, insomnia, showing aggressive behavior, such as trying to harm herself and the baby, and she's actually more easily triggered. As example, when the baby cries. She also mentioned that she feels worthless and inadequate as a mother. History taken from the mother-in-law's deal. She also mentioned that recently the relationship with the husband, which is her son, has been strained as the husband hasn't been helping much and they have been fighting or quarreling about it lah. Husband will not show support and instead say things like, what's so difficult about staying home and taking care of a baby. She also started to withdraw away from her family and friends, unlike her usual self, who is very bubbly and cheerful. Okay, so now history taken from the mother herself. She looks unbothered and unkempt. The whole room is in a mess. According to her, she has been feeling very depressed and worthless. She feels guilty and inadequate as her mother-in-law and husband hasn't been offered good support. Reason being, the mother-in-law insisted for her to exclusively breastfeed, even though her supply is low, which makes her really stressed. And her husband uses demeaning tone to talk to her every time she requests for help. Stating that taking care of a baby is easy and she can't even accomplish it. Because of this, she has lost interest in activities that she used to enjoy and unable to complete day-to-day tasks. Eventually, she's very annoyed every time when the baby cries as it gives her anxiety and it stresses her out. As day goes by, she started to have thoughts of harming the baby and herself. Therefore, she lashed out and harmed the baby when the baby cried before the grandmother managed to stop her. Next, I'll be passing on to Baron to talk about the challenges on emotional distress.
Okay, so now we'll be going through the challenges faced by patients with PPD and some strategies to manage. So the first challenge is emotional distress. So patients may exhibit these following actions and signs. So the first point is intense emotional distress, so such as like sadness, hopelessness, and irritability. So and also there's thoughts of self-harm and suicide, and then aggressive towards herself or to the people that want to help her lah. So some strategies to manage. Okay, we have to approach her with empathy and understanding. They also have to speak to her in a soft and friendly tone lah. So to establish this safe and supportive environment for her, and to let her know that we are there to help her and then she's not alone. And then as we approach her, as we talk to her, we have to maintain this proper body language lah. Always smile, be in an open posture, lean slightly forward, use appropriate hand gesture when we talk to her. Okay, the second challenge, it will be our communication barriers. So patients will exhibit these following signs. So difficulty in expressing themselves clearly, and then also difficulty in articulating their thoughts and emotions. So when this patient talk to us paramedics or hospital staff, they may feel embarrassed talking about it lah. So they may speak softly or hesitate while speaking. So because they are feeling the shame and guilt and a sense of burden. So some strategies to help them with it, right? Or help us with it. We ask open-ended question, and then as we ask the question, give her some time and space to talk and express themselves lah. So in this case, if needed, we need to create this safe and supportive environment for her because of a scenario at home, a situation at home. Okay, so to allow her to express herself, so be in a room with her and just the paramedic. Okay, then we have to enter to the room with no judgment and assumption. Then as we talk to her, build this interpersonal relationship and practice active listening. So to listen actively and acknowledge her experience and feelings. So understanding from her point of view, we can also offer emotional support and reassurance to help her with her situation lah. So I'll hand over to her to talk about the remaining challenges and strategies.
So now I'll present the last two challenges. The second last challenge is social withdrawal, where from the history taken from the mother-in-law, she already informed us that the mother is already distancing herself, withdrawing herself from the closest people in her life, which is the family members as well as her friends. Hence, she will present as withdraw from social interactions. Then in this scenario, the paramedic crew and the law enforcement officers, which is the police officers, are there to assist to save the baby. So to the mother, we are just people that she had never met before, and this is the first time meeting us. So hence this will build up even like a bigger wall to prevent her and will isolate herself away from us. So she will be very reluctant to engage with the paramedic crew. So you can imagine that between her and between the paramedic crew and the police officers, there's a very huge brick wall there. So the strategies to manage to break down this brick wall, social withdrawal, is that we cannot be judgmental and we cannot assume we know what is happening to her. This is because that we can never understand what she's been going through. Even though, let's say, the paramedic crew herself faces postpartum depression, everyone's experience is different. So we can never really understand how she really feels. So in order to break through that brick wall and get in touch with her, we have to show tender, loving care to the baby as well as to her, to show that we are there for her and that so that she can let her guard down. And we have to go in with an open mind and cannot be judgmental as well. So the last challenge I'll be talking about is lack of motivation. So the mother will present lack of motivation and interest in daily activities where she will just isolate herself in like a room or something and just don't want to do anything at all. And she will appear apathetic as well as indifferent. And this provides even further more challenges that will prevent the paramedic and the police officer to even engage with the mother in the first place. Moreover, convincing her to seek further treatment for her postpartum depression. So some of the strategies to manage this lack of motivation is, after we break through that brick wall from the social withdrawal, we can talk to her in a nice and calm voice, Also, we can also gather the family members, so like talk to her and the family members together about the situation that the family is going through. Then once to get them know about more about each other and get a sense of, okay, this situation is getting very serious, then we can try to encourage them to go for family therapy, such as the paramedic or the police officers can give like a psychiatrist number or refer them to a family counseling number, so that the family as a whole are able to seek professional help, so that to make their situation a lot better and help to repair their broken relationships. So these are the references that we use throughout this presentation. And the fine print here is, please treat your wife better. This is the key message of this entire presentation. And this is the end of the presentation. Thank you so much for listening.